everyone. I'd like to welcome you to BTSS Talk. And our talk today is really about diet and nutrition for brain tumor patients. As you know, brain tumor is a challenging disease, and we would be, of course, very concerned about how our diet plays a role in helping us to manage the disease and also in our road to recovery. So I'm very happy today to welcome a new member of the BTSS community. Her name is Mette Petersen. She has migrated to Singapore, or rather relocated to Singapore with her husband, who is now working here. And she came from Australia. Yeah, Mette, is it Gold Coast, right?
No. Sydney, New South Wales.
Okay, Sydney in Australia. All right. Yeah. And one thing you might want to know about Mette is that very recently, Mette has a wonderful daughter, Alma, who at a very tender age organized a bake sale and actually get it a little donation for BTSS, and we truly impressed by her big heart even at a tender age. So well done for your parenting, Mette. Yeah. And I noticed that we have, okay, at least 10 people already, and more would be joining us. So I would like to share the format for today's presentation. So what we would have is everyone on mute, yes, and also hide the video for now until we go to the Q&A session. So we would first invite Mette to give a presentation, and she'll be showing her PowerPoint slides. Then after that, there would be time for every one of you to show your video, and we start to have a discussion with her about your concerns. Yeah. So I think I recognize everyone here except for Marisha. I noticed that you are a nurse. Could you please maybe Marisha? Hi, are you a BTSS member or you're a new member?
I'm a member.
Oh, okay. Are
Yeah,
you
I'm a member in BTSS. I'm a patient
okay?
also.
Oh, you're a patient also. So welcome to you. It's good to see you. That you're
Yeah.
also in the healthcare and also a
Yes.
patient and also a
Yes.
member of BTSS. So
Yes,
that's
I am.
great. Thank you for joining us today. And I suppose you will have some perspectives to share with us too. Yeah. Okay. So without further ado, so let's warmly welcome, Mette.
Thank you.
Thank you for having me. Well, I'm here today to tell you about nutrition in relation to brain tumors and more to cancer treatment. So my name is Mette Petersen, and I'm a bachelor in dietetics and a dietitian. So I work with dietetics or nutrition for 6 years now, and mainly because I'm traveling as an expat wife because my husband is sent out by a very famous company called Lego. So I'm traveling with him. So I'm educated and qualified to work in hospitals as per normal, but I can't do that when I'm abroad. So I work mainly with weight loss and diabetes management, which is also very interesting areas. I could say that. So eating and drinking is often related to big difficulties and issues when you have a brain tumor or you are receiving treatment or after treatment. That's why I think it's a very important issue to address and to educate about, because there's probably a lot of things that will be new to you, but there will also be maybe a lot of things that you've heard before. So maybe it's just a good thing to get that refreshed. So this area of dietetics within cancer treatment, and especially within brain tumors, is very close to my heart, as I have a daughter who was diagnosed with a brain tumor 3 years ago now in 2019. So of course, I haven't had any possibilities or opportunities to work more besides just study about it. So this is actually my first time talking to a group like this and to actually talk about it instead of just reading about it. So this is very, it's very great for me. Actually, I'm very excited to do this today. I believe there's still a lot we can do within nutrition and especially cancer treatment. So I will talk more about that when I get to my slides in a second. There's still new and emerging research and science coming up every day. A lot is focused on one or two things, but I think that there's actually maybe some light at the end of the tunnel, that this could be actually some very interesting research. And I will also address that a little bit later in my slides. But especially that it can be concerning treating or helping controlling tumors. My presentation today will be a mix of a classic presentation and also handouts. So that's why some of the slides can come across a bit busy, but I'll try to keep it as light as possible and just highlight the most important things. So I will start the presentation now by sharing my screen. Is that okay, Melissa?
Please, Mette, I want to say that you're doing great and we're really excited to hear from you. And yes, I will be hiding the video now. And yes, go ahead and share your screen.
Okay, I will try and share here. Yes, where we have it. All right. It's not on that because it's on the Zoom. So I'll go into this. Sorry about that. And now
Right, and while Mette is getting her slides sorted out, I would like to welcome the new joiners to our group session. Mette is a clinical dietitian. She earned her credentials from Copenhagen University, and she has 6 years practice in the different areas of nutrition related to issues such as diabetic management, weight loss management. In addition, she has been trained to do cardiovascular, obesity, endocrine, as well as cancer-related issues, how this can be supported through the diet. Mette, are you all right? Do you need my help with that?
find it. It should be here. I don't know why it's not coming up.
It's okay. Take your time. You
Uh,
go, yeah.
oh, no.
You go to share screen
Yes.
and yes.
On this,
Now I see something like your WhatsApp.
I can see that. Oh, here we go. Sorry about that.
Yeah. Yes.
It's a lot of windows open here. Maybe I should just take that away. Don't save. Right. Okay. And now I have to move that little thing over here.
Very good.
Send.
And present. Yeah, voila. You're all set. Okay, let's go.
Over here like that. Yeah.
Mhm.
Okay. So let's get started. Sorry about that. It's all about the technical stuff here. And there we go. So today's content will be, first of all, I call it our story and not my story because it's the whole family that's part of our situation. And then I will talk about diet and brain tumors. And next I'll have, that's the biggest one, that's the diet and treatment and the side effects from treatment. And the last one, which is probably very interesting for a lot of you, that's the facts and myths that's all over the internet and in newspapers, all the news research and what to believe and what not to believe. So I will have that as my last point. And then at the end, I will have room for questions, so Q&As. So our story, well, this is my daughter, Alma. She was 5 years old when we were noticing that she had a loss of strength in her right hand and in her arm. It was on a trip to Tasmania. I just noticed that she was putting on her clothes with just one arm. And when I asked her why she was doing that in a very weird way, she said, oh, because I forget her right arm. And then I knew that that couldn't be normal. So we went to the doctor's place and they actually referred us to a scan the next day. And on her scan, the 10th of April, which will be, yeah, I still get emotional when I think about that day. we saw a very large brain tumor in her thalamus region, which is called a thalamic brain tumor, making, unfortunately, this kind of tumor inoperable. It's so deep in the brain, it's just on top of the brain stem. So going in there and doing any kind of incisions would be crucial. So they decided to do biopsy, even though it was very hard to get in there, but it was very important for us to know what kind of tumor we were dealing with. So luckily, I can say so, she was diagnosed with a benign pilocytic astrocytoma, which is a slow-growing, low-grade tumor. So there was time to get the right treatment and to start with chemotherapy, which we did. And she received 12 months, 13 rounds of chemotherapy. That was a combination of carboplatin and vincristine, which is a very gold standard within brain tumors. And we were able to shrink the tumor 25%, which is a miracle. So today she's not receiving any kind of treatment, but we are monitoring her every 3 months. She goes to an MRI, and so far, thank God, there's no progression and it's stable. So diet and brain tumors. So what you eat when you have a brain tumor, and also in any other situation of life, determines whether you lose or gain weight. It influences your muscle strength. It affects how you feel in general, and it affects your body how to respond and recovers from any kinds of treatment, and especially cancer treatment. So keeping a healthy and well-balanced diet is, after being diagnosed, is very important and can benefit you in many ways. So it can benefit you in the way of keeping up your strength and energy, maintaining your weight, and also the body's store of nutrients. It's lowering your risk of infections, and we know how important infections are when we are going through treatment. And it's helping and healing our recovery process. So I just want to you have seen all this one, all of you have seen this one before. It is the normal healthy eating, eat well guide, as it says on this one. We call it the Y plate, not the Y like the WHY, but the letter Y, and it's because it's actually a Y upside down. And this is eating healthy plate, so you can see how you should allocate and distribute, your different kind of nutrient groups. So over here you see all the vegetables and the fruits, some of the fruits, especially the berries. And over here you see all your carbs and your starch. And down here you see your proteins, and that's divided between the dairy product and the more fish and nut protein. So this is how you actually, if you picture your plate, this will be a great way to set up a plate. And if you are losing weight, you will actually divide this in half, and one half should be vegetables over here, and the one quarter and the second quarter should be starch and protein. But this is how a healthy plate should look like. So I'll just go back. Yeah. So diet and brain tumors again. So there's some special considerations when you have a brain tumor and you are receiving some kinds of treatment initially. And maybe during treatment. I know that my daughter got steroids before she started treatment. And so when you get a long time use of steroids, it's very important that you get extra calcium and vitamin D, because the steroids actually get, you have to have a deficiency in calcium and vitamin D. So how to get that? So you know that you get enough, and in this area you cannot get too much of calcium or vitamin D. So don't be afraid that you think you eat a lot of this already, but if you don't, you can maybe start eating some of it, and you will not ever get too much. So it's just more and more important that you don't have a deficiency, so you actually can add some of these food groups or food products to your meals or to your food. So milk, cheese, and yogurt are really good sources. They are high in protein also, and they are high in calcium and vitamin D. And you can see all kinds of dairy alternatives or products is all good in calcium and vitamin D. But if you have any kinds of lactose intolerance and you drink some kind of other dairy products, then choose always the one that's added calcium. Here you can just get a picture of how much is a portion, because we're aiming to get 2 or 3 portions a day. So a portion is actually, if you take like 1 big glass of milk, that's 200 mils, that will be 1 portion. And also, if you're trying to lose weight or to have to manage your weight and have a stable weight, then always go for the low fat and low sugar variants and products. So diet and treatment. So during and after a brain tumor, during and after treatment for brain tumor, and it doesn't matter what kind of brain tumor, or if it's surgery, radiotherapy, chemotherapy, and other medications, so, that could create some symptoms that makes your eating and drinking challenging. So you may have to modify or change your diet from the healthy model into a different kind of setup, just to help your symptoms. And so I will try and clarify that a little bit better. So first of all, I want to mention hydration before I go into the food areas, because hydration is very, very important in the many cases, but it's helping the process of your drugs, such as your chemotherapy, to get processed better in your body. So the more fluid you have in your body, the better medicine works. It also avoiding bladder infections, and we do not like infections, as I just said before, when we're on chemotherapy. So side effects such as diarrhea or vomiting, actually, where you lose a lot of fluids, so you need to replace that fluid, and you need to replace all the minerals and electrolytes you lost. So keep drinking a lot of liquids. And if you so if you are have been through diarrhea or a lot of vomiting and because of nausea, there will be some kind of rehydration drinks that your medical team can supply you, which will be very good in exactly the minerals and the electrolytes to get that up in on the right level again. So the side effects of treatment and some dietary tips to help you cope. So some of the side effects is probably well known to a lot of you, but poor appetite and losing weight. It's increased appetite and gaining weight. It's fatigue. You're actually too tired to eat, too exhausted to eat. It's nausea. It's a very common one. Feeling sick. And constipation is very common as well, not as outspoken. I don't know if it's because it's the constipation idea, but I don't know. It's not as outspoken as the nausea. But I will go through that one as well, because actually Alma was very much had that as a very big side effect of her medication, not as much the nausea, but more the constipation. And that was just really, really horrible. So I can talk to you about that, and I have a lot of personal experience in that. And the last one is also one of them that Alma had a big one of, that's mouth and throat issues, but I will get more into that in details. So poor appetite and losing weight. So when you are receiving treatment, and also before, you can lose your appetite and not feeling like you want to eat anything, and you're starting to lose weight. So it is important that you still try to eat a little bit, and eat maybe small portions, very small portions, instead of big portions or big meals a day. Like normally you say like three big meals a day, but trying to make them smaller, so 6 to 8 small meals or snacks each day. You maybe need to set an alarm to remind you, because maybe you're sleeping all the time, maybe you're watching telly all the time, when you're in hospital, maybe you're at home. But it's very important that you get reminded that, oh, now it's actually a good time to have something to eat. And it doesn't have to be a lot. It just have to be, keep your metabolism going and get something in there. Because when you are sick or when you are receiving treatment, you're probably not moving around that much. So you don't need as much as you normally do. So, but still, remember to eat just a little bit. Everything counts. And also, if somebody is making plates for you or they are setting up something on the table, a full plate can actually be very off-putting. It's just overwhelming, and you maybe just lose your appetite just looking at the plate. So keep small portions. Remind your caregivers or anybody else that maybe helps you with your food, that keep the plate small, keep them interesting, keep them a bit colorful. Don't just put mashed potatoes and brown gravy on top. Try to make them interesting and appealing. So for some people, they only maybe have the energy or they have the appetite for one big meal a day. So I would recommend, and often it's the breakfast. I think it's because we've been fasting while we are sleeping. And so we wake up sometimes feeling a little bit of appetite. So if that's the case, try and make a good filling breakfast and cook meals like oatmeal or some kind of eggs or potatoes or something that's really good and filling could be a really good idea to eat at that point where you have a slight bigger appetite. And to get some extra energy and protein, and that's very important with the protein as well, because protein is helping you recover and helping your body recover, because everything and organs and muscles and everything we use in our body is built up by proteins. And so we need proteins. So I would recommend trying to add, something that's very dense in energy. Could be cream, it could be mayonnaise, it could be oil, it could be nuts, it could be nut butter, it could be Nutella, something that's high in energy and can be small portions. So there's been a lot of hospitals in Denmark, especially one big hospital that's been trying this by a very famous chef in Denmark. And we are known for good food in Denmark. So this famous chef actually took over the whole kitchen in one of the biggest hospitals in Denmark, and took over one of the cancer wards to try help to get people to gain weight because they were just losing weight. And he made the smallest, nicest, yummiest treats where the density of energy was so high he could almost fit 300 calories into a slice of this by adding stuff that actually very dense in energy. And if the patient were able to eat that, it will be such a success. So there's so many ways to do this. So please talk to your dietitian at the hospital or your medical team, how they can help you so you just don't get that plate standard food from the hospital and you just can't eat it because it doesn't look that appealing and it's probably not put together the right way. So yes, that's poor appetite and losing weight. The next one is the increased appetite and gaining weight. And I know this could be and is a challenge for a lot of cancer patients, especially those that receive steroids. So there's more reason to the increased appetite or the gaining weight. So the gaining weight could also be because, as I just mentioned before, the decrease in physical activity due to that fatigue or that you're tired. And other side effects that just makes you like not running around, such as constipation makes people lay very still and because maybe moving around is painful. Increase eating due to you're bored, so you just keep eating, in front of the television, you maybe just in bed, you just because you're bored you eat. And that's not just because you're sick, that happens for a lot of people. So it can also be because when you are anxious, you're stressed, you're depressed, some people tend and turn to food, and that helps them feel something, so they start to just eat more. And then the very famous steroids that can create quite a big weight gain, and because of the increase of appetite and also the body stores the energy in a different way. It actually stores the calories into fat easily when you're on steroids. So you don't use the energy, or the energy is not used efficiently. So you will actually store that extra energy you have as fat. And the steroid also make you retain fluid. So a lot of your weight can actually be due to water retaining and not due to fat as such. But it could be a combination. But it feels the same way. But just so you know that it could be also water retained. And you can also talk to your medical team about this. They can sometimes help you with if it's a lot of fluid, but they will assess you and see if it's a lot of fluid you have or not before you do anything else. So what can you do when you have an increased appetite? Well, there's no easy way to reduce your appetite. It's not that you can take a tablet and your appetite goes away. Unfortunately, that's not the case. And it's also very, very difficult to lose weight while you're on steroids, because of the water, but also because of how your body will store the calories that comes in. But there is some helpful tips that I will give you, some you can try to do. So try eating more lower fat products. That's, it's all from the meat. It's down to all your dairy products. Everything you can think of, cutting away some of the high sugar content foods like cakes with cream on. So stick to more protein containing food. Protein actually makes you feel full. A lot of people don't think about protein being the most filling nutrient we have, but it's actually the most filling nutrient we have. It's not carbohydrates, which a lot of people think. And it's due to a lot of things. That's more about chemistry, but I think that a lot of people understand that actually the protein molecule is a very, very large molecule. And that actually helps us fill up quicker, because when it gets into our system, we actually releases the hormones that tells our brain that we are full quicker because of the size of the molecules. So eat more proteins, and that's the lean meats, and that's what I call the white meats. So that can be pork and chicken and fish. Eat eggs, also some of the legumes like lentils or beans. It's really good for feeling full, but also they are very high in protein. And also with your carbohydrates, your starch products such as bread and pasta and rice, eat the ones with the whole grains. So you have a lot of fibers, because fibers actually make you full quicker. And it's really good for your digestive system as well. And I will get to that when we talk about the constipation, but choose fibers over anything else. Even though, you maybe feel that you want your white bread, maybe choose not the one with all the grains. If that seems too much and too heavy for you, then you can always choose the wholemeal bread. Just my son. Choose that instead, because they are a bit lighter to look at and to feel at, but they are still filled with a lot of fibers. Yes, so yeah, always include starchy foods as well. Always have some pasta, bread, or rice when you are eating, because that will fill you up as well, quicker than you just eating, let's say, it could be cakes or something like that, crisp or something, but actually have some good pasta. And if it's the whole grains as well, or the whole meals at the same time, you will actually feel full quite quick. And also when you're eating snacks, have them ready. Have some good healthy snacks ready, and that could be fruits, that could be vegetables, that could be some nuts, some crackers. Have them ready, so when you are hungry, you don't just jump into a bag of crisps or cookies or cakes, but actually you can just take that out. Help your caregivers or anybody in your surrounding or in your network support system that helps you have these bags of healthy snacks close by. and be as active as even possible. That means that, you know, if it's just walking a little bit and that's what you have the energy for, please do so. If you have energy for more than that, that will be just perfect. For my daughter, while she was receiving chemotherapy, I took her and it took her onto walks out with a scooter. And we chose, I want to mention that because I think it's a very important thing. We chose for her to have a porta cat and not the, what is the name of where you have the tube on your outside. She had like her port inside. That means it's covered by the skin. So every time she had her chemotherapy, they had to access it through the skin with a needle. But when they took the medicine away and she was not in treatment and she could go home, if she's so lucky that you can go home, she could actually still swim. And living in Australia, we have nice weather, like here in Singapore, so she can actually still go in the pool. She was not restrained in any way to do all the things she loves to do, like going out with her friends or riding a bike and riding her scooters and just run and play some ball and do some fun stuff, which you actually, that's exercise. So even though you're having fun or you're just playing, if you're a child, it's still exercise. So I think that's very important thing, that's why we chose it, and it really worked out well. And drink a lot of water and low calorie drinks. Don't fill up on sodas and high calorie drinks, such like sodas or juices or something like that. Stick to water. Water is the source of a lot of good things, especially when you are ill and you are receiving treatment. So if you ask me as a dietitian, I would say water any day. But I'll get to that, when you have loss of taste or you funny feeling in your mouth, water can sometimes be hard to drink. You could always have sparkling waters, give that fizzy thing in your mouth, but also you can add a little bit of cordial or some kind of flavor just to make it, a bit more interesting. But drink, get a lot of fluids and a lot of water. So yeah, obviously avoid sugary and fatty snacks, as I just said before. So fatigue when you're too tired to eat. So it's very, very common. And I know that from when the time was when my daughter was in hospital. At the same time, the steroids was actually before the chemotherapy started. So when she was on the steroids, she gained a lot of weight. But when she got on the chemotherapy, she lost a lot of weight. And it was due to, initially, it was to constipation. But when they got that figured out, it was due to fatigue. She was just, I don't know if it's a combination of being, depressed or just very low energy. So it was hard for us to get her to eat anything. So I can have some of the standard recommendation, and then I can give some recommendations of my own. So try having, again, the 6 smaller meals instead of the big, large ones, because it's hard to get through large meals and you just lose interest. You're almost starting when you look at the meal and it's so large. So stick to small ones so you can actually, it's not overwhelming in any way. So to save time on cooking, and if cooking is it takes up too much energy just thinking about it, use ready meals. There's so many nice ready meals out there today. Ready meals is not a bad word, as it was maybe 10 years ago when we talked ready meals. We talked TV dinners, and everybody was like, oh, it's really bad for you. But there's so many ready meals out there. You can order online or you can buy it in the store, and they're so nutritious, and they even have the nutrition label on it, so you can see what's in it, how many calories, how much protein. Go for the high protein ones. Go for the one with the lower calorie. If you want to lose weight, go with the one that actually have some pasta and some other stuff that's in higher calorie if you want to gain some weight. And you can always add some extra vegetables to those ready meals, and you can buy that in bags as well, and they are really great. And sometimes You know, if you buy the frozen ones, they are even more preserved, the vitamins, because they get frozen right away after they got picked from the trees or the bushes or the plants. They get into bags and they get frozen like this. So they actually contains sometimes more vitamins than the ones you can buy in the store, because the fresh ones actually been transported all the way from I see stuff from America and from Australia. It's a long way, and they lose a lot of their crispness and the vitamins and the minerals inside them. So go for the bag ones or the frozen ones. They are really, really good, actually. And also accept helps from others. I would say this as a very, very, very important one. As a Dane, we are not used to accepting help with especially food or people, you know, preparing meals for us. So in the beginning, I felt like, oh no, we're not, you know, we can manage, we can absolutely manage. But when people started to putting meals on our doorstep, it was so touching, first of all. And second of all, that was the best gift you could ever give a family that's in a situation like us, was actually prep meals, home cooked meals from our friends. And it was so wonderful. And there actually we got so much that we just put it in the freezer, and we had food for such a long time. And it was the best. I would say it's the best thing you can ever get, because then you have it and you can choose whatever you want every day. Like, oh, do you want the pasta bolognese, or do you want the lasagna, or do you want the broccoli pie, or whatever. They made so many nice things. So please accept help with the food shopping and the prepping of meals and cooking and everything, if you can, please. And I know when you're feeling tired and fatigue, a lot of people tend to drink those energy drinks like Red Bull or something like that. They're very high in sugar and caffeine. And maybe they will give you initially a lift and you feel, oh, they give you some energy, but they actually can make you feel worse long term. And that's feeling worse in a lot of ways. Oh, it says my internet connection is unstable. I hope you can hear me and everything is okay.
Yes, you're fine. You're
Good,
doing
good.
good. Yeah.
Okay, good. Um, so yeah, so they can actually make you feel worse, because when that wears off over time, then you can actually almost feel even more tired, and you can even feel more um, hungry, or you can feel, you know, there's a lot of side effects of drinking those caffeine drinks. I would never recommend that to anybody. So yeah, just try to avoid those. Um, yeah, so nutritious meals don't always have to be hot meals. It can easily be a cold meal, or some salad, or cold pasta salad, or something that may be easier to just throw together, or for others to help you with. It could be just a piece of bread with some salmon on top and avocado on top, something that's easy. It doesn't have to be hot meals. Nausea, this is one of the big ones, because I think a lot of cancer patients, due to the treatment, feel nauseous or get nausea from the treatment. So some ideas that can help you with nausea, and if you're also vomiting, again, eat smaller meals. It's like it's repeating itself, but it's very important. The small meals is actually really important when you're going through treatment or you are sick. And a very important one is also, do not try to miss a meal because you think, oh, I feel sick if I eat anything, or if like, oh, I gained so much weight, I'll just skip this meal, because an empty stomach can make your nausea worse. And it actually can give you stomach aches, and it's better just to have a little bit to eat, and that could actually help the nausea feeling, that it doesn't get any worse. So this is a thing I remember with my daughter, that avoid rooms and foods with strong smells. There's a lot of things my daughter don't eat today because I was not thinking. So when I had my dinners, when she was admitted to a hospital, I went just down to the cafeteria or the cafe, and brought up my meals, which often were hot meals, and they apparently had a very strong smell to it. So now my daughter, there's some of my foods that I like, she can't even have the vision of or the smell of, because that really reminds her of when she was in hospital and she was feeling sick from it. So I always had to go somewhere else to eat my meals. And sometimes she didn't even like the smell of my clothes when I came back. So be careful with that. Also, room temperature cold foods are often best. Again, it's easier when you're feeling nauseous to have some yogurt, some cold fruits, or ice cream. And I know they have a lot of this at the hospitals. And stock up in your freeze at home also on that, because it's very easy just to grab one of those, and like an ice cream or some yogurt, to have that if you're not feeling well. And try to eat dry foods. That always helps me personally if I feel nauseous. Crackers and dry cereal and breadsticks or some kind of crispy and dry food. Also having drops, I think you call it here, like sweets, sucking on them could help you with your nauseous. Mints and slices of fruit, again, that's the fruit from before. And avoid the greasy and fatty foods. So they take longer to digest, so you actually feel the food longer. But it's also can actually stir up something in your tummy when it's too fatty. Yeah, and I'll continue on the nausea because this is one of the largest ones. So again, so the liquids between your meals and even between your bites of food, have a little bit of liquid in between, because that helps to reduce the nausea. And the fizzy drinks actually helps as well. I have heard some people mention ginger ale. And again, because of the ginger is very good with the same with the peppermint. It's very good when you're feeling nauseous. Cola is that's an oldie but a goodie. I know I said that before, that keep away from the sugary fluids and drinks, but in this case, if you're feeling nauseous, you're probably not overeating or eating too much, so that could help you just to get something down that's also with some calories and some energy in it. And remain seated upright for at least an hour after you eat. So if after you eat, don't just lay down again, because that can just stir up the nauseous and stir up maybe you're feeling sick. And again, with the peppermint and lemon and ginger, drink or have it in hot or cold, doesn't really matter, can ease the nausea feeling. Yeah, as I said, try not avoid eating your favorite foods, because maybe when you're done with the treatment, it's not your favorite foods anymore. So sometimes that helps. And also being anxious and being stressed can actually stir up the nausea and makes you feel a bit sick. So try, also when you make meals, but eating your meals and between your meals, to stay as calm and relaxed as possible. So the constipation. So the constipation can be due to a lot of things, but it's for us, it was the vincristine that was the bad guy. The vincristine, Alma had, they try with the highest dose in the beginning to see how much you can tolerate, and the vincristine actually was really hard on my daughter. So Alma was admitted to hospital for, I think, 7 or 8 days, constipated. And I've never seen anybody in such big pain. It was crucial as a parent to look at, because I really felt helpless. And being a dietitian, and I was like, but that, constipation, there's things to do here. We can do something. And it was hard, but initially, finally, we got the intestines working again, and the constipation was like over. But it's again, with the high fiber in your foods. So here it is very important that, when you don't feel hungry, it's hard to, take so much fiber in. So again, keep it as whole meal bread, something that's whole meal. Have some small fruits, some small vegetables, something that will start up. And that's, Grapes are really good. They can, like, you know it from prunes and other kinds of sultanas. If you can get that, that's even better, because that actually can help to set off the intestines from the acidity of the fruits. Drink a lot of fluids. So I know it can be hard to drink, because when you are constipated, you feel full all the time. You just don't want anything inside your body. So maybe drinking could be the way. It also could be some soups, but for the fluids, here it's actually a good way to actually have some juices, to drink juice, because the juice contains the fruit acid, as I mentioned before, that helps kickstart the intestines to work. And then try and keep active. I know when you're constipated, it's really hard to get out of bed or do anything. If you can, try move around. I know the nurses, and when you're in hospital for constipation, they all say that all the time. And it's just small things to get out of bed and get into bed again. Small things help, because every time you move, your intestine starts to move. And when they start to move, they can process and get stuff through that needs to get through. And sometimes when I mention the soup, a hot drink can actually also set to kickstart the intestines to work. So the taste changes, that you lose. You either lose your taste, or you suddenly have unpleasant taste in your mouth. Some reports of bitter and metallic taste, and some could be very sensitive to certain kind of flavors, such as I mentioned here. The sweet food is very, very sweet, or salty, or it's very, very salty. So it's that could be some of the taste difference, and that's also due to the medication, either the chemotherapy or the radiotherapy, that can changes your taste and smell. But good advices and some tips for that is to keep your mouth fresh by rinsing it just with water or some mouthwash. You can brush your teeth frequently. You can also try to experiment with different kind of flavors, that to see how they taste. I mentioned some of them here, but there are millions, so you can try whatever you want. You can also try some chili, or the chili is mentioned, but something that's very spicy, to see if you still think they're spicy. And if you don't like salty foods, try some sweets, and the other way around. Try really to experiment with your foods, and make your surroundings and your network help you to introduce new foods and new flavors that you never tried before, just to play with it. Because all of this will go away again. Yeah, for a lot of us, that will go away again. So it's just for the time being, but that could actually prohibit you from eating. So I want you to try and experiment as much as you can. So again, with the flavors, lemon and vinegar, something that's very I don't even know what you call that, but acidic is not the word, but it's pickles and relishes and stuff like that. That's a bit where's that word? Well, you know what I mean. And the last one is the dry mouth. Also, some that my daughters had also blisters in her mouth, which can make it painful. But in this case, she had also dry mouth. And again, if you have a dry mouth and you don't have the saliva, you don't feel like eating. It's your brain telling you, well, I can't really process this, and I can't break it down, because even in our mouth, we start breaking down all our nutrients. And if we don't have the saliva to make it go down smoothly, but also we can't break the food down, our brain actually don't want to eat anything. So we can help the brain and help the body to moisten our food by have small cool sips in between every little bite we take. And we can again try to drink fizzy drinks. That helps when you have a dry mouth. It kind of just give a little sensation in your mouth. Try the ice lollies, to suck on those. That helps really nice when you have a dry mouth. Ice cubes, frozen grapes, and I know frozen pieces of oranges are amazing. So you should try and make some cubes and put them in the freezer. They are really, really great. And also, don't eat any too dry food, but always use some kind of sauces and gravies, or custard if it's a dessert, and that makes it more moist. Yeah, so again, the same thing as before, with the taste and the feeling sick, is also find something where you can suck on some sweets. It helps you produce more saliva, and especially also chewing gum. So the last one is, can diets help treat brain tumors? There's a lot out there, and you probably have heard all of them, and you probably have looked into them as well, because this is interesting area, and some of it is maybe it's written too much about because there's not a lot of evidence, like scientific evidence behind it. But some of it, it's actually baby step, or in the the initial state of research. So it's still in the how do you say that? Laboratories. Yeah, laboratories. Yeah, doesn't matter. Okay, so as I said, there's a lot on the internet and the newspapers about curing, or even control, even curing, but also controlling tumors through your diets. And it's difficult for especially people that doesn't have the same education as me, that have the education within the dietetics in depth, to see, or to understand if this is real or not real, and what is evidence, what is scientific evidence, and what is not, and what is what is the quality of these scientific reports, or the research that's sometimes all over the place on the internet. So I'll just move this one down because I can't really see the last one here. Yeah, so I would say that before you change anything in your diet, and it's if you are cutting out one of the nutrition groups, or whatever you choose to do, please, you have to talk to your doctors, your medical team, the health professionals, to discuss your wish or your options, or what you can do with if you have a wish within changing your diets. And so you don't just change them without consulting some professionals. It's very, very important. Oh, no, I'm back. So the first question I have is, and I call this facts or myths. So should I cut sugar from my diet? That's a big one, because we all know that, or we have heard that tumors, they kind of live off sugar. They live off our carbs, carbohydrates, from our foods. But so does every cell in our body. They all live from the carbohydrates, because they live off glucose, which is carbohydrates. And so sugar is glucose. So what if we just cut the sugar away, and then everything will be fine, and maybe we'll starve our tumor cells, and they will die eventually. But the problem is we can't. Oops, sorry, I went up. Here we go. Sorry. No, we can't just do that, because our body will actually. We can't do that, because they will. Our bodies will not usually allow these levels of glucose in our blood to get too low. So we cannot starve them, and we cannot starve the tumor cells that way. In fact, some tumor cells will adapt to the new environment if we try to do that too low, and get our sugar too low. So that will not help them from doing that. Well, I have a little problem down here. I can't really see my slides, but I will get there. So that's not an option, because, as I said, the body will just regulate. We have glucose inside our body, and we will just regulate. And I will come back, because there's something in relation to this, but I will mention it because I'm also going to talk about the ketogenic diet. And so it's kind of merged together, these two, with the sugar to cut that out, and the ketogenic diet. So I will just mention something in the next slide. So again, we cannot just cut out sugar, because our body will just add the sugar from inside, from our storage inside. So the ketogenic diet, is that a way of curing and controlling a brain tumor? So there's no clinical evidence that this kind of keto diet can control or cure any kinds of tumors. So that it's believed, the argument why a lot of people is writing about this and talking about this is, okay, let's just cut out the glucose, and at some point when we get too low on the glucose, on our sugar levels, on our carb level, our body will then start to produce what is called ketones. It's called ketone bodies, but also called ketones. And ketone can't, the cancer cells cannot live off ketones. So all the other cells in our body will live perfectly because they will just get their energy from the ketones. But the tumor cells, which cannot, and that is what they believe before, they cannot live from the ketones. So eventually, then the tumor cells will start shrinking or even die. That is what the argument is. So the newest research has actually found out that tumor cells can live from ketones as well. It's still, everything here is laboratory based, so it's still in the laboratories. There's so small human research in this. It's very, very limited and very small population or small groups or cases. So there's nothing here that can say that there's evidence behind any of this with the keto diet, but it's definitely something that is very interesting to look at. And one of the reasons, because after they found out that the brain or the tumor cells actually can feed off ketones, is that when you are receiving radiation or radiotherapy, if you are on a ketogenic diet, some research has actually shown that the radiation actually attacks the tumor cells with living off ketones better than living the ones that live off the glucose. So they have seen that as being very promising. But again, it's still in the laboratories. There's nothing done on humans yet within the radiations and the ketones. But again, this is a very interesting area that I will keep focusing on and keep my interest in, because I actually feel there's some cases, I know of individual cases where they have tried to experiment with the ketogenic diet. And again, please don't experiment with anything before consulting your medical professionals. But if I have read about some people that have tried to do this and have actually had good results. But again, there's probably 100 and 1,000 that has no results at all from having or living off a ketogenic diet and receiving treatment or seeing any kinds of reaction on the tumors. I'll just move this over here again. Here we go. So that's, it's just the second part of the ketogenic diet, because it is one of the biggest one. I think I receive a lot of questions about this, because there is a lot of writing on the internet and in the newspapers about it. And I just want to emphasize again that it is very interesting area, but again, there's no there's no evidence, scientific evidence that this is a way to go or that this is working. So I would still try to not jump into this, but there's nothing, there's nothing dangerous in trying to do this if you talk to your medical team, because I cannot take I only talk from what I know and for my daughter, if she was the case. It's very individual how you will react to a ketogenic diet. So please don't do anything before you talk to some professionals. So there's still poor research and it's very limited. But let's see what happens in the future. I'm very focused on this area. So another one is the alkaline diet. It's a new one to me, but apparently this has been also out there for a while. And the whole argument and what they believe is that it's based on that around the tumor cells, in that environment the tumor cells are in, is very acidic. So then people are thinking, oh, if that's very acidic, what if I eat a lot of alkaline food that will then even out? Then maybe it will get the environment to be alkaline instead of acidic, and maybe then the tumor cell can't survive in it. So, and to change your acidity and your alkaline levels in your body is your pH balance. So, and to change that, first of all, you can't do with food. You cannot from outside change any pH level in your body. If you were able to change your pH level in your body, you will most likely die pretty quickly, because it is very dangerous to have just a tiny little difference in your pH level. So this is actually physically impossible to do this. You cannot eat anything that will change your alkaline environment in your body. And if you could, it will be very, very dangerous for you to do. So there's no idea or benefit from creating any kind of alkaline diet or whatever they call it. But so please, I can rule that one out right here and right now, that this will not have any effect. So on the last one, I would mention is, and I hear this a lot as well, oh, it's better to buy organic, right? Because organic, it's better, because non-organic is probably, that's very cancerous. It can cause cancer. It can cause cancers, and again, there's no evidence that organic foods are better for brain tumors, but any kind of tumors. And I know for a lot of people that's a big surprise, because they're so contaminated with poison and other kinds of things if they're not organic. Well, all vegetables and fruits and everything should be washed, because they can be you use poison also in organic produce. When you're producing crops, you are still allowed to use some kinds of poison for your crops, not as many as if it was non-organic. But if you wash that off and go out for foods that's that's covered with the shell, like oranges and stuff, like where you peel it, then you are most like, there's no difference in organic food and non-organic food. I think it's a lifestyle choice. It's what you believe in, because there's unfortunately there's no evidence that shows that is any better for you to have organic food than not to have it. So yes, Q&As, there you go.
Okay. Thank you, Mette, for a very, very comprehensive.
Oh, well, my goodness, was it too much?
Just for the benefit of the rest of you, Mette and I actually had a discussion, and we talked about the usual questions that I hear brain tumor patients asking. And I think that she's really spot on, isn't it? In all the things.
Maybe I went a bit over top there with information, but I wanted to
Okay,
cover it all.
right. So I will start the ball rolling, and if you like to ask a question, you can put it in a Zoom chat, or we can invite you to show your video and ask your question, so that we could all have a discussion together. So my first point, Mette, concerning organic food, perhaps you'd like to go to the last point.
Yeah. Mhm.
Yeah, it's the fact that I think many patients want to go organic when it comes to vegetables. It's because of the way it's grown. So hopefully it would have less pesticides,
Yes.
right?
Yes.
And so because I do hear that even when you try to clean your vegetables with a vegetables wash, sometimes there would still be residuals left, because it's impossible for your detergent to do an absolutely great job, you see. Yeah.
Yeah.
So in terms of the veg, that's the concern. Now, in terms of the meat, it's because many of the poultry or the cattle, the meat that we eat, these animals receive growth hormones injections. And we primarily concerned that consumption of, let's say, chicken that has been injected with growth hormones, or beef that has components of growth hormones in them, would inevitably introduce growth hormones into our body that may encourage the proliferation of cancer cells. Yeah,
Mhm.
so that's the thinking behind it.
Yeah.
So if I was to present it that way, would my way of thinking have any merits?
Well, first of all, the growth hormones used in animals are not comparable to the human hormones. So we cannot just uptake um, other species hormones by eating it, getting it into our body. It doesn't quite work that way. Then I think we will take a lot of you know chemical substance or chemical bindings in our body from everything we eat. So especially the growth hormones, there's been no evidence that it shows that we take that into our bodies and into our systems. Um, and so there's no evidence out there at the moment that shows that is the case.
Oh, okay. I see. That's interesting. Yeah. Okay, maybe you should stop the sharing of your slides unless we need to refer to it. Now I've got questions coming in already, and the first question is about apple cider vinegar and honey. Is it a honey drink? Is it safe to drink?
Yes, it's perfectly fine. Just don't drink it too concentrated because it can actually be very acidic for your esophagus. Yeah,
Yeah.
it could be
So
very
should
hard
it?
on that.
So does it mean that it also should be taken on a full stomach and not an empty stomach?
No, it doesn't really matter. If you can tolerate it from in the morning, that is great. But again, there's no scientific evidence that shows that it has any health benefits whatsoever. There's a lot of writing about it, and to be honest, I've tried it myself just to see what the fuss was about.
Yeah.
and
I'm still
that goes
trying
for,
it. Yeah.
goes for a lot of the things out there. I've tried it myself to see, what is this? Does it help in any way? For me, it didn't do anything at all. It didn't increase my appetite if I wanted to lose weight. It didn't do anything. I just found out that if the concentration was too high, it was really painful for my throat.
Okay. Well, for me, I find it's quite cleansing, especially after
Oh
you
yeah,
have an oily meal.
yeah,
Then I find that if you do like apple cider, it kinds of, clears up the grease.
yeah.
Yeah. Another of our participants is asking whether or not a vegetarian diet, that means one that's without any red meat, helps in controlling the growth of tumors.
Again,
Again, I think it's got to do with eliminating, the meats which has a lot of like
yeah,
hormones and stuff.
yeah. Well, it is. Again with the red meat, I think it's really hard to find out because again, I have not seen any clear scientific evidence that actually shows that should be increasing cancer risk in any way. They are saying that it could, but I guess that a lot of things like going out in the sun could also increase your risk of getting cancer. So I would say limit your, also because of the environment. To be honest, I also think about that, but limit the red meat, definitely. I would do that in any way if I could. Go vegetarian. It should be a choice of beliefs. It doesn't have any, again, I'm talking out from not my personal perspective, but in the scientific evidence. There's no gain in going vegetarian when you think about cancer or brain tumors. If you want to do that, then we just have to remember to get all the proteins you can get from legumes, from beans, and from all other kinds of
Yeah.
sources.
Which is a little bit hard to get actually, because I find that if I was to depend entirely on vegetables for protein, you often got to go for the beans, and
Yeah,
a consequence of that is having a lot of bloatedness.
yeah, yeah.
Yeah, right? Because when you consume beans, somehow it creates more bloatedness in the
Yes,
tummy.
yes.
Yeah,
That is true. I think you should again experiment with the different kinds of legumes, lentils as well, the combination, what you have it with, and see what is, makes you less bloated. Because for some people, I know a lot of vegetarians, and I always talk to them about the are you getting bloated? And some of them say no, never. So I don't know if it's an individual or your system just have to get used to it. I think also maybe that could be it from the beginning, but I think that goes for a lot of changes. When you change your diet completely, I think your body needs time to adjust.
yeah,
It's just not like from
yeah,
one day to
yeah.
the other.
Just can't do it overnight.
No.
Yeah, that's right. Okay, so Mette, can you please stop sharing your screen?
Oh,
Yeah, so
oh,
that
sorry. Yes,
yeah,
yes.
because some of them can't see others with the yes,
Oh,
they can't see us. So
no,
great. So now they're having a
there
great
you
view of
go.
you
I'm back.
and me.
Yes,
Yeah, and there is also a question. We have someone who is experiencing seizures, and
yes,
she we have spoken about the connection between there's no connection between ketogenic diet that
yes,
has been shown by research to be helping in terms of curing cancer.
yeah,
But on the other hand, would it, can you hear me? All
yes, I
good?
can hear
Yeah.
you.
Yeah. On the other hand, would it help prevent seizures?
Well, initially, ketogenic diet was developed to help epileptic, epileptic children from to reduce seizures. So definitely that could be something that could be interesting to look into if that also goes for seizures caused by brain tumors. I don't know if it's the same. I'm not that way a medical. I'm not a doctor, so I can't say if it's the same um, issue that occurs when you have a seizure as the one you have when you have um,
Epilepsy. Yeah.
yeah, epilepsy. But I would definitely talk to the medical team because they must definitely have had that question before, so they could help you guide you with that.
Right. Okay.
It's
Well,
very
yeah.
interesting, actually. I think
Yeah.
that's very interesting.
Quite interesting. Yeah. So I think that's good to know that definitely has its roots in the treatment of epilepsy patients and
Yes.
something for our participant to think about. Now, there is another question, of course, that relates that a lot of us can relate to, and it really deals with the hormone replacement. As you know, a hormone replacement medicine like hydrocortisone as well as thyroxine, right?
Yeah.
Many of our pituitary tumor patients have to take this on a regular, daily basis, actually. And one side effect is, of course, being putting on weight a lot more easily
Yes.
than other people. And we talked about it already quite a lot, in terms of the management of weight, because Mette did say that it's got to do with water retention as well,
Yeah.
and that we've got to manage the weight, etc.
Yeah.
So, but the thing is that for those of us who really want to lose weight, and we are on lifelong hormone therapy, for example,
Yes.
what is the thing that we can do, to gain back part of our normal,
Yeah.
yeah, figure, yeah.
Well, first of all, it could be interesting to actually get assessed how much your of your body is fluid. How much fluid have you retained from the medication, and you can have it's easy to do a scan so you can see how much fluid you have in your body, but you can also do measurements of your fingers and your ankles to see how much fluid, because if a lot of it is fluid, some of it, let's just say 50% of it is fluid. You can have some medication that I think you call it water pills, but the Rutica, I think also you call, where you actually can get, you can lose the water.
Okay.
First of
No.
all, I would do that, because instead of fighting something that's just water, that's something you can get easily help with. And second of all, it is really I have to be honest, it is hard when you are on hormones and you are on something in
Steroids,
relation
yeah.
to steroids that that you can lose weight. It's just your metabolism is just so different than from when you're not on it. So working against it by cutting away foods or skipping meals, it's not going to help. I would be honest and say it's not going to help much.
Okay.
So
Right.
it's find out how much is water, get rid of the water. Second of all, try and cut away as much of your excess fat and sugar you
Sugar.
can from your diet, and try to eat a lot of fibers so you feel full longer. That's the best advice.
Right. Mette, I just want to check with you because I was told by some people that our water component should be like about 50% actually. So is that considered too much? What is the normal water
50,
component?
50,
50%, right?
50, yes.
All right, so I'm right then. If
Yeah.
it's below 50 means that I'm dehydrated. So we need to keep
Well,
it at about
I
50.
think for grown-ups it should be between, I think actually it can go down to 45 to 65, but in that range. And it's again, if you're still in your your cycles, you have your cycle as a woman, you will go up and down in your amount of water throughout a period of 30 days. So
Okay, got that. So, how about physical activity? I mean, like for example, we can't do anything in terms of the food consumption. We are doing our best as far as intake is concerned. How about like doing more rigorous exercises while we are on steroids and hormone replacement? Would it help, or it would still be a little bit self-defeating?
well, self-defeating is such a
I know, you know what?
word.
I'm just being
No,
realistic,
I,
you
I,
know?
no,
Yeah.
I know what you mean, but definitely everything will help, it will all help. It's just harder than normal. Um, your metabolism is just so different. I won't use the word slow because then it's not the right word to use. It's just the metabolism, the setup is different. And so the storage of fat happens much faster than if you would eat something and go for a run, and you can count your calories, say, oh, that's 500 calories, that matches my food intake. I'm on zero now. I have, I didn't gain anything.
Yeah,
But that's not the way it is when you're on steroid. It
I
works
see.
differently. So even if you went for a run on 500 calorie run, it would probably maybe be only 100 in the equation in your body.
I see.
So everything helps. Doing nothing is absolutely the worst you can do. So everything you have the energy of doing. So I would go, if you can do a run or something that's more challenging, go for it. Again, I want everybody to check with the medical teams and everything, so I don't send people out
Yeah,
running because
yeah,
I don't know everybody's conditions here.
yeah,
So, but I would say exercise is always good, and I know the best you can do is going for a walk.
yeah,
Good for your lungs, it's good for your mental health, it's good for your exercise and using your body.
yeah. That's right. Yeah, the same participant is asking whether or not cortisone, if you are on it, exercising could actually lead to the body being stressed as well.
um I haven't heard about that. I've never seen any research showing that exercise can be stressful, even if your body is stressed. I think no matter what, they're always recommending, even in pregnancy, where your body is, in a lot of um, stress. It actually is stress, because stress is not just feeling stress in your head, but your body is also doing a lot of things at the same time. Exercise is always recommendable. So again, I would say even being on steroids or cortisol or anything like that, I would say definitely a good walk uphill. Try to take the stairs. Try to walk to wherever you're going. Try to take the stairs when you're in supermarkets, or just to swab it up a little bit, so you just get some more exercise in between.
Yeah. Okay. All right. That's great. All right. So, any more questions from the rest? from the rest of you? I think everyone is feeling very contented.
But that's good, I hope.
Okay, then I would like to ask some questions about meal replacements. For example, if a person is on chemotherapy, we know that having sufficient protein, it's critical to replace what the chemotherapy might be wearing out.
Yes.
Yeah. So should should this patient take on a regular supplementary basis? Things like ProSure, for example.
Or it all depends on the patient's situation. If a patient is having an increased appetite and eating more, maybe that would be recommended, then no. Because we already, as it is, the most people on a normal diet actually have efficient amount of protein, even when we are not, we are healthy, not sick. So increased appetite will mean that you get more proteins. There's proteins in different, not only in meat. A lot of people think, oh, but I don't eat a lot of meat, but it's in pasta, bread,
Yes.
everything. Yeah, there's a lot of protein in that as well.
Mhm.
Oats, a lot of protein.
Mhm.
So we get a lot of protein. But if we are poor appetite and losing weight, definitely for sure to get a supplement of protein. That will be recommendable.
Mhm. Okay, all right, yeah. Well, personally, I take a lot of protein shake after my workout.
Okay, you do, yes.
Yeah. Yeah, I try to get more protein,
Yeah.
to
Is
help
that instead, can I ask you,
build the body. Yes.
is that instead of your meal, or do you also eat meals?
For myself, I try to make do with smaller meals throughout the day
Okay.
because I find that all of us have comes in different shape. We come in different shape and sizes, you see,
Yes.
and I believe that some tummies are a lot smaller than others, so you may not be able to consume so much very comfortably. So I find it's easier to just have like, like sometimes I'm going to the gym, then I could use the protein shake
Yes.
as my source of energy because I
Okay.
know that when I use it, I have the protein as well to build at the same time for the glycogen and the carbs are all in there as well.
Yeah.
And sometimes I may be feeling energetic, then I have the protein after. And yeah, something like that. Or if I'm hungry, I want a snack, then I have a protein shake.
Okay.
Because I know that the calories for protein shake is like about 250.
Okay. Okay.
You know what I mean? Rather than
Yes.
you
But
take like a biscuit, a few biscuits, and you don't
no,
know,
that's
you
good.
lose
It's
count.
good you
Yeah.
know, because a lot of people don't know. They just say, I have a protein shake, but a lot of people don't know how much energy is in it. So
Yeah.
when I ask, so how much calories in your shake? I don't know, but it's protein, so it's healthy, but protein is still energy. So yeah. So
Every scoop is a lot of calories.
yes, yes. So that's good. 250 is, yeah, that's not too much. That's fine.
Yeah,
That's good.
that's
Okay.
right. Okay. So, all right. So, any more questions?
Actually, I have my daughter Alma wants to say hello.
Okay, hello. Yes, we
Yeah.
love to say hello to
Alma,
her too.
Alma.
Maybe all of us can we also show our camera because we're gonna take a picture soon. So we'll be ending really soon. And let's show her our support. So Ashley, I hope that answered your question.
Yes, I hope we did.
So
This is
all of us
Alma's
come.
face.
Hi, Elma. Hi, Elma. Wow, look at your
Yes, her
hair.
hair is back.
Very nice.
Yes,
Yeah, your hair is all back.
yes.
Yeah.
Now we,
And thank you for organizing the bake sale. You baked the cookies yourself?
Mommy did it.
Uh,
yes, it was teamwork. Teamwork. Yes,
yes, but you were the marketing manager.
yes,
So yes, so you did
and the
great.
cashier. She did the finance as well.
Yeah. Okay. All right. Can we have more of you on the screen, please, so that we can take a picture? There are 21 of us. Come on. Yeah. Why don't you ask Elmo to join in the picture? Mette?
I don't
Elmo
look
to
good.
join.
Now,
Ask, yes,
I
Elmo,
don't
ask
look
her to
good.
join.
No.
Those of you who don't want to look, not comfortable is okay, but we try to get as many people in. Let's try to get like 2 more, and then we'll be perfect.
Okay.
Okay.
Brother.
Can we have one more, please? One more person. Yes, great. All right, let's get ready. Right now, you're gonna take screenshot. You're
Okay.
muted. Okay, ready.
I'll take 3 because I cannot fit everyone. Okay, one
Okay.
first. Smile. Okay, one more. Okay, and last one. All right, everybody's in.
Very good. Right. I hope you enjoyed the talk, everyone. So if you need to go, please feel free to leave. Really glad to see so many of you here. Caroline, hi to you. Hi, Tess. And then if you like to stay on to linger a bit to just chit chat, you're welcome to join Mette, myself, and Ratna. All right. So I hope you enjoyed this chat. And let's give a round of applause again. Yay! Right. Let's use our reactions, Zoom reactions button, yeah, to appreciate her. Yay! So I've got mine. Yeah.
Thank you.
Yeah. Thank you. Right. So Ashley, you want to ask something? Just unmute yourself and then we can chat. Yeah.
No, I'm good. I think she answered the question quite well just now.
I'm still here. Just had to close the door. The kids
Okay.
were fighting.
Because when I asked
Yeah.
my doctor and all, they will just say, "Oh, just normal diet and just exercise," but it doesn't work. But I'll go check out my body
Yeah.
with water percentage, like you say. Maybe
Yes,
that'll help.
yes,
Yeah.
a really good idea.
You know, it's quite easy to buy these kinds of weighing machines where you step on it and it gives you a breakdown of your overall weight, your water composition, your fat composition, and your muscle composition.
Yeah, that's good. I have one. My
So,
dad has one. I think I'll go try that. Yeah.
yeah, go and do it. Yeah. Okay, and yeah, Jun Hong, thank you for your word of encouragement. Yes. Yes, and Adrian, yes, you have a question. Or Kemi? Hi. Yes, Shiba, you want to ask something about your son, Israel? Israel? You are mute, Shiba, if you want to ask question. Don't have, Okay, got it. All right, I hope the talk was helpful. You know, Mette is an immensely, I would say, successful talk because normally we would attract like about 10 people, but whoa, look at how popular you are. You've got like 20 over people.
Oh,
But it also
so
shows that
happy.
this topic is really close to the hearts. Yeah,
Yes.
yeah,
Yeah, I'm so happy.
Everything.
Oh, someone said
yeah.
something? No, yeah, I'm very happy that I was part of this. It's, yeah, as I said to you as well, it's very close to my heart as well. And being part of it and being part of when Alma was in treatment and all these side effects and how to deal with them. And you know, being a medical professional myself, I know how hard it must be for people that's not, you know, what to do and being really lost. We were never suggested or offered a dietitian during this. We were much alone on this because they didn't see it as a very important, and that's the problem sometimes in the hospital, you know, environment that dietitians is not very high in rank. So we get we sometimes get not prioritized, and that's sometimes very unfortunately because a lot of people can benefit from this, and have a quite smoother treatment if they got some help and support in this area.
Yeah, that's right. And absolutely, because you were just spot on, in addressing all concerns about steroids and stuff like that. Shiba's just put in a message as well to say that your talk has been very comprehensive. All her questions have already been answered as you speak. So well
That's
done. Yeah.
good.
Okay, then I think we are all good already. Ashley, so good to see you, even though it's the last minute.
Yeah,
And
sorry.
Adrian as well, good to see you. And I hope to catch all of you at the next support group then. Okay? Yeah.
Okay.
Thanks.
All right. Thank you, Mette.
Bye. Thank
Very
you.
good. It was well
Thank you.
done.
Bye
Yeah,
bye.
it's really well done indeed. Thank you. Yeah.
Bye.
Bye.